Hello, everybody. Hello, everyone, and welcome back again to my channel. I hope you're doing well, great, and excellent. And please comment down below, like, or subscribe to my channel for further review of other system. Sooner it will be, but for today's, we're going to do or discuss about the endocrine system, its anatomy and physiology, how it works, and how this system are very important in growth and development of a person. Without further ado, let's start. Okay, endocrine system, anatomy and physiology. Now, endocrine system are system of glands. These are the glands in our body that secretes hormones. They are responsible primarily for growth and development and metabolism or activity of our body. So what are the structures involved? These are your pineal, which is located on the brain, your hypothalamus, check on that, your pituitary, check on that, your thyroid gland, parathyroid, located there, and also your thymus gland, the adrenal or the suprarenal gland, your pancreas, which is considered as a GIT or the exocrine gland as well, and then your ovary, and then your testes. So these are the structures that we're going to talk about. Okay. Now, what are the functions of your endocrine system? Let's talk the sugar. Everybody likes sugar, especially the chocolate, but not too much, okay? Sugar. So S stands for the stress response by your adrenal glands by secreting the ACTH or the adrenocorticotropic hormone, your cortisol, and then utilization of the glucose for energy because of your pancreas that secretes the insulin that is needed by the cell, so the sugar will go into the cell. Then growth and development, your anterior pituitary gland is responsible for that, specifically the growth hormone that targets bones and the muscles development and everything. Okay, then also A stands for the acid-base balance by your posterior pituitary gland, which secretes your antidiuretic hormone or the vasopressin. Okay, and R stands for reproduction, which is for your ovaries and testes, which ovaries produce the egg cell and the testes produce a sperm cell. And then R stands for regulates vital function by your thyroid gland, increasing your metabolism. So that is a function of your thyroid gland. Okay, so that's for the main functions of your endocrine system. Now let's talk about the glands and the hormones. So what are these? Let's start first with pineal gland. Now the pineal gland is located on the brain that secretes melatonin. Now melatonin is very important in the sleep and wake cycle of a person. Okay, so if we're able to increase the level of melatonin, then therefore you're going to have a good sound sleep. Okay, but too much of that, we're not able to wake up. You're gonna be dead. Okay, next, your hypothalamus. Now the hypothalamus is very important as well, which is located on the brain. You can see here. So this is your pineal gland. Okay, here. Okay, sorry about that. This is not working. Okay, this is your pineal gland. This is your pineal gland located here, and then your hypothalamus is needed to be stimulated as a releasing factor that will stimulate your pituitary hormones to secrete the following. Now, it could also be an inhibitory for your growth hormone and then your thyroid stimulating hormone, okay? Okay, then next is also control some of the somatic function, your body functions such as your sleep, body temperature, appetite, your hunger and satiety center. Check on that, hypothalamus. Okay, I discussed that too on your anatomy and physiology of the brain. If you want to check it out on the video I posted, so you could check that out too. Okay, next is your pituitary gland, which is called the master's gland because it secretes a lot of hormones and parts of the body. Now, the anterior pituitary gland, let's talk about first, is the melanocyte stimulating hormone. From the word melanocyte, it secretes the melanin, which is responsible for skin pigmentation. Okay, now if increased melanocyte stimulating hormone, therefore your skin gonna get darker or bronze skin or hyperpigmented. Okay, if that your MSH decrease the melanocyte stimulating hormone, and then you're gonna get whiter. So that's the difference between the two. Okay, then next is follicle stimulating hormone and the luteinizing hormone. The FSH and the LH are always be together. They are responsible for development and maturation of secondary sexual characteristics, such as for female, which is your breast development, getting sexier, nicer skin. So those are the examples. Egg cell production. So that is for follicle stimulating luteinizing hormone. Then the ACTH, or the adrenocorticotropic hormone, or the cortisol by your adrenal cortex, is responsible for the stress response reaction of our body. Now the THH is targeting the thyroid gland. The thyroid gland is responsible for basal metabolic rate or metabolism. Remember that. So it means like if the TSH is increased, therefore your thyroid gland will also be more activated. Okay, and your metabolism will increase, or either it will also decrease. Okay, growth hormones. Growth hormones are responsible for your growth and development of the bones. So, for instance, if too much active after puberty, you would have acromegaly, wherein the arms are more longer. So like you were having Marfan syndrome, or like your lower extremities are longer, so, or your necks are longer or something like that. So because of the growth hormones. Now, if increased growth hormone before the epiphyseal closure, like between 18 to 20 years old, like you will be called gigantism. So it means your growth is inappropriate at your age. So therefore you're a giant or very tall than a usual age. So that's called the gigantism. Now, the opposite of that, if decreased growth hormone, is dwarfism. That's about it. Next is prolactin, is still secreted by anterior pituitary gland, which is also important for milk production. So that's why prolactin is very important after delivery of the baby, so for production of milk. Okay, now those are the hormones for anterior pituitary gland. Remember those things. So we have your prolactin, growth hormones, your adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, and melanocyte stimulating hormone. Next is your posterior pituitary gland, which secretes two hormones. Remember this. Okay, the oxytocin and then your antidiuretic hormone, or also called as the vasopressin. Now, for oxytocin, it is responsible for uterine contraction. So therefore, after the delivery of the baby and placenta, you massage the fundus of the uterus, or the uterus. They massage it so bleeding would stop, thereby stimulating the release of your oxytocin or the pitocin. Now, the pitocin is the drugs that also given to the women after delivery of the baby, so to prevent bleeding. Okay, now also it could increase the letdown reflex of the breast to produce the production of milk as well. Okay, moving on, for antidiuretic hormone, also known as the vasopressin, it reabsorbs water by the kidney. So it means like the more antidiuretic, or for instance in syndrome of inappropriate antidiuretic hormone, or increased water reabsorption of the antidiuretic, thereby you could have edema as well if too much, and increasing the blood pressure. Remember that for SIAD, or increased syndrome of inappropriate antidiuretic hormone, I stands for increase, thereby increasing water reabsorption. If too much would lead to a problem such as your edema, therefore it would increase the blood pressure. Now the opposite of that is the diabetes insipidus. Decreasing antidiuretic hormone, of course it will decrease water. Some of the problem will occur here: polydipsia, polyphagia, and polyuria. So it means you will have polydipsia because you keep urinating, and then you could be dehydrated. That's why you want to eat more and more. So that would happen with your diabetes insipidus. Remember that. That's the difference of the two, the SIAD and the DI, or the diabetes insipidus. Next, moving on to thyroid gland. Now, the thyroid gland are responsible for increasing your basal metabolic rate. Remember that it increases the activity of the cell. So therefore, the release of the T3 and the T4 accelerates or increase the function of the cell, and as well as increase sensitivity to your catecholamines, which are your epinephrine and the norepinephrine. Okay, so if the thyroid gland, this would happen to you if too much activity, like increasing, would have Graves' disease, like you were super active, your eyes are bulging, your goiter, you have the big thyroid gland. So increased activity, all except for your weight and menstruation. So it means when you have Graves' disease, you're very thin, okay, and bulging eyes. So there are also risks for increasing the vital signs, and as well as your risk for having the thyroid storm. So that's for Graves' disease. Okay, now decreasing the function of your thyroid gland would also cause you to have coma or the myxedema, because the vital signs are all decreased or down except for the weight. So it means the weight, you're gonna be fat here, okay, but your vital signs were all decreased. So that's for myxedema, coma as well. Okay, now thyroid glands also responsible for secreting calcitonin. Now the function of calcitonin helps to deposit calcium on the bone to make it more stronger and hard, okay? So eventually calcitonin opposes the function of your parathyroid gland, which secretes parathormone. So remember that. So it means if that calcitonin is not functioning well, your calcium would go to the blood and not deposited on the calcium. So that would happen eventually with calcitonin, okay? So remember that that's for the thyroid gland. Now talking about the parathyroid, or it secretes parathormone, okay? Now the function of your parathormone regulates the calcium and your phosphorus. Okay, now the parathormone, if that increased level, you would lead to hyperparathyroidism, and then if that is decreased, then hypoparathyroidism will occur. Now the thymus gland, moving on with the thymus gland. The thymus gland secretes this hormone called thymosin. They are responsible for maturation of your T lymphocytes. Now what is the function of the T lymphocytes? They are responsible for your immunity. So they are responsible for that. So that is for the thymosin. Moving on for adrenal cortex. Now, the adrenal cortex is located on the kidney, the adrenal cortex, and the adrenal medulla. Now, from the word cortex, C as in cortisol, they secrete the ACTH, or the adrenal corticotropic hormone, which are responsible for stress reaction. And if you're stressed, you will secrete a lot of sugar, sodium, and your other hormones as well. Okay, now talking about this, the salt or the sodium, the mineral corticoids, cortisol again, are responsible for sodium retention. Therefore, if there is a sodium, there is water, and they are happy together, increasing your blood pressure. Okay, now with the mineral corticoids, so increased sodium called the disease, increasing of this called the Glands disease. Check on that. However, if there is increased sugar due to glucose, from the word glucose, glucocorticoids increasing the blood sugar. Okay, so that is for that. Then, however, if there is decreased androgenic and estrogenic hormone, that's the sexual hormone, increasing the three, the SSS, the salt, the sugar, and the sex, increase with Cushing's disease. Decrease of the salt, sugar, and the androgenic hormone, you would have the Addison's disease. Remember, okay? Cushing's disease increase. They're gonna get fat. They're gonna have the obesity or truncal is big, truncal obesity or something like that. So that is Cushing. Fat. They have salt, they have water, they have sugar. They are stressed in response to that. So adrenal corticotropic hormone is increased. Okay, it's the opposite of the Addison's, wherein decreased sodium and decreased sugar. That is Addison's disease. Next, moving on for adrenal medulla. Now, the adrenal medulla secretes these catecholamines, your emergency hormones called the norepinephrine and the epinephrine. It increases, of course, the cardiac, your heart rate responses, and the cardiac output through your vasoconstriction of the blood vessels, thereby increasing your blood pressure. Now, for bronchodilation, it would increase your respiratory rate or the respiration through bronchodilation, okay? So to ease the breathing, they would responsible for that. Now, the increase of the epinephrine and the norepinephrine, sometimes there is called a condition called pheochromocytoma, that unable to control the blood pressure. So the person keep having increase in blood pressure due to this condition, like they have like additional growth of the tissue on the adrenal medulla. Okay, so if they keep producing and producing the catecholamines, therefore increasing blood pressure. So eventually, if this would happen, some people, they do surgery. Okay, remember that. Moving on to your beautiful pancreas. Now, the pancreas has two cells, the alpha cells and the beta cells. The alpha cells secretes glucagon, while the beta cell secretes your insulin. Remember that. Now, what are the functions of this? Now, the alpha cell secretes glucagon, and glucagon is responsible for increasing the blood sugar. So therefore, increasing blood glucagon, therefore hyperglycemia. If decreased, then therefore hypoglycemia. Both are symptoms of also diabetes mellitus. Okay, remember this thing. Okay, so if sometimes you would discuss this on the diabetes mellitus. Now, the beta cells will secrete this hormone called the insulin. Now, how important is your insulin? Now, insulin is like a precursor or energy pusher, so that the glucose or the sugar will go inside the cell. So without the insulin, therefore, your glucose stays on the blood, and that will lead to hyperglycemia. Okay, So if there is no insulin that is produced by the beta cells, or either there is a resistance of the insulin, therefore you would have hyperglycemia. Okay, now increased insulin would also lead to hypoglycemia, wherein how the insulin itself, they have a resistance of the insulin on the tissue or the cell, then therefore the glucose cannot be utilized by the cell. It cannot enter into the cell itself. Therefore, you would the sugar would either excreted. I mean the insulin will be secreted, and therefore you would have the hypoglycemia as well. Okay, so that's for your pancreas. Now remember, pancreas is an exocrine gland because it has function on the GIT and it has function as endocrine gland. Okay, endocrine. Okay, moving on for the testes. Okay, now the testes secretes a principal male sex hormone called the testosterone. Now the function, sorry for that, the function of this is, of course, as male, it will target the male secondary sexual characteristic, so such as deepening of the voice. You're gonna be have like a hair, axillary, the hair, or you're gonna be like more masculine. Okay, so that's it. Prevention of osteoporosis as well, and bring masculinity. So that's for testosterone. Now for ovaries, there are two hormones that secretes this one, the progesterone and the estrogen. Okay, now the progesterone functions principal hormone for P as in pregnancy. Okay, in order to be pregnant, they need to increase production of your progesterone. Okay, now it also regulates the menstrual cycle together with the estrogen. Check on that. And relaxation of your smooth muscle. What are examples of smooth muscle? Your GIT tract. Okay. Now moving on with the function of your estrogen. It regulates the menstrual cycle. I've told you about it. That's why if they have irregularities of your menstruation for female, sometimes they need to give estrogen hormone, or like injection, or giving estrogen pills or something like that. Check on that. Female secondary sexual characteristic, that's why ladies are having a fine skin, beautiful skin, they get sexier, they gonna have the big boobies, or they also had like a big hips or something like that, and their face is small or something like that. They're also responsible for bleeding. I mean, like to prevent bleeding or having clotting, more clotting for that. Maintenance of the skin integrity and blood vessels. As I have told you, if you get older and then you have menopausal, so the skin integrity, they easily break because of that, and the blood vessels, they constrict, okay, and thereby having a high blood pressure. So that is the function for women for the estrogen. And lastly is it prevents osteoporosis because it prevents escape of the calcium into the bone. So therefore it will be reabsorbed on the bone and then not allowing that to escape into the blood. So that is for osteoporosis. That's why those menopausal women, sometimes they need to supply more estrogen. So because they have decreased releasing of estrogen by your ovaries during that time. Okay, so those are the functions of your estrogen and progesterone by your ovaries. That be all. I hope you learned from my video, and thank you so much, and God bless. If you do have questions, please comment down below and enjoy watching. Thank you.